We've all heard of vertigo. Many of you have experienced it, but what is it? What causes it? And how can you stop it? Vertigo is not just a condition or an illness. It's a feeling, the feeling of spinning, tilting, rotating, or even the room spinning around you, and the sensation of not being able to control your body. Vertigo is not a diagnosis, but a symptom. It's a problem that arises because of what is known as asymmetry in the vestibular system, the visual system, the auditory system, or the somatosensory system. Dysfunction in any of these can cause a balance disorder. A balance disorder causes the perception of unsteadiness in any position you are in. These systems working together is a paramount for normal movement, balance, and function. If they're disturbed, imbalance or vertigo may result. We also know that vertigo has symptoms of its own, like dizziness, nausea, vomiting, and even migraines. The symptoms can be as simple as not being able to stand still, or they can be potentially fatal if not treated properly. If you have any of these symptoms and a sense of spinning, you have vertigo. So what part of your body is connected and causes vertigo? The vestibular system is in the inner ear, and it contains organs of balance and spatial awareness. It is also connected to the brain stem. Vertigo is one of the most common neurological complaints, and it affects nearly 25% of the entire population. When there is damage or dysfunction to the ear, the inner ear, the eye, the vestibular system, or the base of the head and neck, components of your balance system are being compromised. For example, when you get to high altitude, maybe on an airplane flight or driving up the mountain, you may feel your ears pop. That's your body and brain adjusting to the altitude in order to keep your balance and vestibular system working properly. If your ears do not pop, if you do not feel the pressure, they are not calibrating you to your surroundings and therefore impairing your inner ear, which could lead to vertigo. The major consequences of even momentary dizziness is falling. This happened to my mother. She was having occasional dizzy spells that she ignored and discounted until one day she fell and fractured her skull. After having a fracture with hemorrhaging into the brain dealt with, she seemed to be okay. However, the signs and symptoms of dizziness were not addressed, and she continued to ignore them until she fell again in the middle of the night. She was just getting up to go to the bathroom, and she fell and fractured her hip. This doesn't sound like a big problem, but as you know, or may not know, 25% of our elderly population, when they have hip surgery, do not recover consciousness after the surgery. That's what happened to my mother. She never recovered consciousness after a successful hip surgery, and she eventually passed. Now it's time for you to act. If you get dizzy or lightheaded at any time, even momentarily, if you think you're suffering from vertigo or susceptible to getting it again doing certain things, please do not ignore it, do not discount it, and do not blow it off. You need to immediately determine how much you are at risk of falling. The most effective way to evaluate your risk of falling is to have us do a brain balance test. It is a computerized test that evaluates your brain's control of balance. It takes about 11 minutes. If you're having balance problems, dizziness or lightheadedness, if you need or use hearing aids, or if your vision has recently changed, your risk of falling may be compromised and increased. When we have determined which parts are working properly and which parts are causing the dizziness or vertigo, we create a written report of your balance status and the causes of the problems. We then develop a tailor-made, specific treatment protocol to correct the causes and a home exercise program to strengthen the corrections. My recommendation is to call us now at 913-491-1071 and request a brain balance test. Do yourself and your family a favor. Call us now and request the brain balance test. Call 913-491-1071 now and request the brain balance test to determine if your risk of falling and the causes of dizziness can be corrected.